This is Average Joe PT, and today we're going to talk about the hip. Like always, I'm going to keep on giving you the content, all right? I want you to subscribe down below, hit the call bell. Here we go, stay tuned. All right, folks, so we're going to talk about the piriformis muscle that gets overdiagnosed sometimes. And so it sits, I'm going to represent with this rubber band, pretend it's the muscle. It sits on the inside of your tailbone and inside your sacrum here. All right, the tail being down here, it sits on the underside of your sacrum. And then you got one on each side of your leg. And it's the main rotator muscle that allows your leg to rotate out to the side, or we say our major external rotator muscle. And so I got this guy fixed pretty good together, so he's not moving very well. But essentially it's gonna run like this over to your leg, all right, your femur bone, and attach there so that so when it works, it pulls and rotates your leg backwards. Now right next to it is this giant hole here. Now this giant hole is where the sciatic nerve runs through. Now on some people, this piriformis muscle runs below. So just pretend this nerve is coming out. Hi, how you doing there? This is your sciatic nerve. So sometimes it runs below, all right, the nerve that piriformis muscle does. Sometimes that piriformis runs above, all right, so kind of look at it that way a little bit. And then sometimes it splits the nerve, so it runs right through. Those are people that got some problems if that piriformis splitting the actual nerve, all right. And so that's really bad for people. They're probably gonna have if that muscle starts to get irritated or contracted, it's gonna start squeezing on that sciatic nerve. But if you're having some sciatic nerve issues, it's very easy for this muscle group to get irritated along with it, and along any of the muscles that run down into your leg. I'm going to bring it in real close. This joint right here that I'm kind of running through is called your SI joint. S meaning sacrum and L meaning ilium. In this case, people think your pelvis, but this part is called the ilium, so it's SI joint. So it's really one of those three areas. And so when you're having this quote-unquote piriformis issue. So I'm going to give you some techniques to do to hopefully reduce your symptoms. Overall, we're going to compensate for the lumbar spine as well as reducing some piriformis issue. I'm going to give you some strengthening exercises and some gentle stretches. Here we go. Treatment number one, ice or heat. If you're getting sciatic kind of symptoms down your leg, ice, ice, ice. If you're not, and it seems like your symptoms are only in your butt cheek area, you can do either ice or heat. 15-20 minutes, 3 or 4 times a day. Just don't burn yourself. Treatment number two, be very careful on either a lot of massage or tennis ball. I see some people do some sort of rolling on it, like a foam roll. Be mindful. Remember, you have that sciatic nerve coming right out through where that muscle goes above or below. You start rolling on that muscle a lot, you're going to irritate that sciatic nerve. That sciatic nerve does not need compression on it. So hold on, here we go. All right, starting number one. All right, let's say that the piriformis is on this side. Or let's isolate the spine from the hip. And that way, you just pull that back in, tuck the hips in, open and close. The second one, boom, pull yourself straight, tuck the hips in, the hand there, and then up. Pause, and then back down. The last one you're going to do is lying on your stomach now. People, take a pillow, put it at your belly button, so that when you lie down flat, don't come up on your elbows. Stay down nice and flat, and all you can do is lift that leg up, pause, and then back down. 3 different strengthening exercises that you can easily do at home. All right, so that's all the exercises and manual treatments you should do, at least until you see a therapist. Maybe that'll get your symptoms completely gone. All right. And so, like I always say, subscribe down below. Subscribe. I'm going to keep bringing you content. I love all my subscribers that are here. Thanks for coming. Thanks for showing up. Leave some comments down below. What do you want me to talk about next? Always look up and keep smiling.